my name is Lakeisha Thompson, and I'm a student of Maryville University, and we are doing a head, ears, nose, and throat exam. This is my patient today. So we were going to start with the eyes. We'll start with the surrounding structures. We're going to start with the eyebrows, and we're going to look to make sure that the eyebrows do look proportionate size and that they both are out to the outer canthus of the eye. We're also going to go into where the orbit area is to make sure there isn't any edema, any puffiness, any sagging or drooping. We're also looking at the eyelid itself to make sure that there isn't any crusting, any lesions, any discharge from either of the margins of the eye. And then we will go and look at the eye itself. And also there isn't any styes or anything like that. So it's all within normal limits right now for him. So we're going to go ahead and take a look actually at the eye. And in the eyelashes also, we want to make sure that they're not inverted or everted. And they do look pretty normal. So we're going to go ahead and just palpate also the eyelids to make sure that we don't feel any nodules, which I do not. And also in doing that, I checked the lateral apparatus and there wasn't any excessive tearing. So we're going to go ahead and look at the conjunctiva. I'm just going to have you look up for me. And it does look pink and moist, and there isn't any discharge, any nodules, any foreign bodies within the eye. We're going to also look at the sclera, and right now his sclera looks white and clear. We're also going to look at the cornea and just make sure that we have a corneal reflex. So we're going to look at using this cotton wisp and make sure that he has that. And so he does actually blink on both sides using that. And then now that also tests the corneal reflexes, cranial nerve number 5. And then looking at the iris in both eyes, they are both the same color. His pupils are equal, they're round, they're reactive to light because they're both constricting. And also we'll check for accommodation. So if you can look at me right here. Okay, and they also did reflect and accommodate to the light. So lens also looks transparent, and then the sclera does look white. So extraocular movements we're going to do. We're going to do the 6 cardinal fields of gaze, and that is we're going to go up to the right and just follow my pen light with your eyes, down to the right, up to the left, and down to the left, and then up in the middle, and then down in the middle, and then we're going to go in and check convergence. And he also tested positive for that. So we're going to also check with the ophthalmoscope now, and we're going to just go in and look at his eyes. I'm going to start at a higher number so that we can actually just view his iris and pupils. Okay, just look at me. And then I'm going to actually dial it down so that I'm able to see into his eye. I'm going to have you sit a little bit to this side for me. Okay, that eye. Perfect. And then I'm going to have you look over towards the window for me. And I'm also looking now for the red reflex, and then I'm looking for the fundus. And looking into his optic nerves, and it does appear that his eyes, oh, that's really cool. Okay, so it does appear that his eyes does show the optic disc is more of like a yellow creamy, and his fundus also is more of a yellowish color. I do see retinal vessels, and they do not pulsate or pulsate at all. So they all are intact. So we'll go ahead and start with the ears. We're going to start with the external part of the ear, looking at more of the auricles, and we're going to feel them just to make sure that we don't feel any lesions or nodules or any type of extra growth. We're going to check to make sure the size is correct, and that they're equal, and that they actually are able to draw a line maybe from the inner canthus of the eye to the outer ear and make sure that they are aligned properly, which they are. Then we're going to go ahead and look at the tympanic membrane of both of the ears just to verify that there's nothing going on with the tympanic membrane, and that we don't have any type of infections or anything else, and that it does look pearly gray. So I'm going to go in and take a look at his ears. And yes, they both do look to be a pearly gray. No discharge, no cerebrum, no tenderness, even when we were palpating. So we will go ahead now and move on to the making sure he doesn't have any discharge from either ear canal, no scaling, no redness, that he doesn't have any discharge, which we don't see any of that. So we're going to check now the hearing test. I'm going to do a whisper exam, and I'm going to have you hold on the opposite side of your ear while I'm over here. So go ahead and hold over there and just repeat after me.
A, B, C.
Okay. I'm going to come over here and I'm going to have you hold the other side. E, F, G.
E, F, G.
Okay. So we're also going to check the Weber test. And we're going to check for air conduction as well as bone conduction. Air conduction should be at least 2 times more than the bone conduction. So I'm going to go ahead and try this. Tell me when you stop hearing this. Let me try that one more time.
Okay. Still hear it. And I can't hear anymore.
Okay, awesome. Let's try this one.
Can't hear it. Can't hear it.
Okay, so he did test positive for having the air conduction 2 times more than the air conduction, or air conduction 2 times more than the bone conduction. We're going to also test the Weber test, and then tell me if you can hear this on both sides of your ears. Hold on, let's try that again.
Yep, I can hear it on both sides.
Perfect. Okay, so he tested positive also for that. So now we're going to go into the nose. We're going to check shape, size, and color just to verify that it all looks normal shape and size. There's no deviations, that he doesn't have any types of septum deviation, that he doesn't have any type of discharge, or any kind of scratchy, itchiness, redness. And it all looks in line. It looks good in size. We're going to check the nasal mucosa and just make sure. And both sides of the nasal mucosa do look pink and moist, and there isn't any signs of inflammation in the turbinates. So we're going to palpate actually the bridge of the nose and just make sure, and it doesn't look like also he had any blockage on either side of his nares. I'm going to go ahead and just palpate his nose. Tell me if you feel any tenderness.
No, it feels good.
Okay, so he was negative for any tenderness, and so we'll check actually to palpate his sinuses. We'll check his frontal sinuses as well as maxillary sinuses. Tell me if you feel any tenderness when I'm doing that.
Feels fine.
Okay, so patient actually says that he doesn't have any tenderness upon palpation of his frontal or maxillary sinuses. We're going to go ahead and check now his lips. We're going to start with the mouth and look at the outer surface, obviously, and go in. So currently his lips actually look uniform. The size is correct, proportioned. He doesn't have any lesions, any crusting, any cracking, any dry lips. So they're both pink and moist. We'll go in and look at his teeth. If you can open for me. So his teeth currently are touching even on the back molars. He does have white teeth, no discoloration. There doesn't appear that there's any teeth missing. He has all of his teeth currently. And then I'll have you open your mouth. And then I'm going to look actually at your tongue. So tongue right now is moist and pink. He doesn't have any dry mucosa. I'm going to just take a look at the right side here, and I'll have you turn your tongue to your left. So in looking at his tongue right now, he does appear to have no lesions, any nodules, any edema or swelling. I'll have you go ahead and turn to that side. And also the same on the other side. I'll have you lift up your tongue for me. And same on, I will have you go ahead and put your tongue down. And just go ahead, ah.
Ah.
Okay, and I also see that the top of the uvula as well as the soft palate does actually reflex when I do that. One of the things I realized I didn't do also is the cover and uncover test. So I'm going to do that just to check for strabismus. So I'm going to cover your eye on this side. Oops, sorry. I'm going to cover this eye. And then, okay, one. Okay, patient is negative also for strabismus. We're going to go ahead and just double check. I didn't get to go back and check his gums, so I'm just going to look over his gums, make sure there isn't any swelling, any redness or edema, and it all looks within normal limits for that as well. So at this time, I think we have concluded the part of our exam. Thank you very much for watching. Have a good night.